So thank you all, thank you Mayor for your partnership, for being here, and let me get started. So we've all heard about the measles outbreak in West Texas, and if you talk to any of these doctors, you'll see that up until recently, a lot of doctors had never encountered measles. Certainly those that have been practicing most recently, it was something that a lot of us had barely heard about. Prior to the 1960s, 1980s, around 1 in 4 people with measles used to end up hospitalized. Now, most of us were vaccinated when we were children, and that's why we don't hear about measles. Measles is very, very contagious, and so I said the rate of folks that were hospitalized, each person with measles used to be able to infect 18 other people. So to put that into context, a person with COVID used to infect on average 3 other people. So just imagine what it was like before there were vaccines with a virus that was so contagious, and the fact that we really don't hear about it, don't deal with it. That's because of the vaccination efforts that took place after this, around the 60s and for a couple decades after that. So what is measles? And folks here will explain what are the symptoms that people need to look for and to go to their primary care physician. But it's a very contagious respiratory disease. So if somebody coughs or sneezes in a public setting, the virus itself lingers. The virus remains alive for up to 2 hours, and that makes it particularly infectious for up to 2 hours. That might just sound okay, respiratory issue. Could it be like a bad cold or the flu? Why should we be worried? But it can lead to people, 1 in 4 get sick enough that they need hospital care, and there can be very, very serious complications that the doctors can explain as well. So what's happening now? On January 23rd, we learned about 2 cases of measles in Gaines County in West Texas. In just 1 month, cases jumped from 2 to 168 cases across 9 counties in Texas and 1 county in New Mexico. So I want to be clear about how significant this outbreak is in West Texas. It is not normal to have an outbreak like that. This is not something that we see in the United States, something we have not seen in decades. And so in past instances of cases in the United States, we may have 100 or a couple hundred, but they'll be spread out. It's not an outbreak where that virus is spreading from community member to community member. It'll be isolated people who have come back from traveling, who maybe were not vaccinated and have brought the virus, but that virus doesn't spread because those around them are vaccinated. So it's good news that the cases are still in the surrounding region of Gaines County, the neighboring areas of New Mexico, but of course we can be pretty much sure that eventually the virus is going to reach Harris County. We already had 2 cases in January, and so we have to be prepared. The data shows us the vast majority of the people who have contracted the virus in this outbreak were either not vaccinated or of unknown vaccination status. So that tells you the good news, which is we have a way to fight against this virus. We're very fortunate there are currently no active cases in Harris County, and that measles is a completely preventable disease. We can prevent this from becoming any kind of emergency here in Harris County if we're proactive and make sure everybody's vaccinated. We do have a very high vaccination rate, but we want to, if it's around 94%, we don't want it to get lower than that. We certainly want it to get higher so that makes sure we absolutely have that herd immunity that we need. Now, let me just be very clear about this, and I'll close my remarks soon. When we hear outbreak, we might think of COVID. We all have that trauma. Okay, we all lived through that, and we're strong to be here. But this is not COVID, okay? This is not that. COVID was so dangerous because it was a new virus. It was a new virus. We hadn't seen it before. We didn't have a vaccine, if you'll recall, for a good year. Measles is not new. We've had a vaccine for decades. However, unlike COVID, measles, again, is a lot more contagious, and also there is not a treatment in the sense that, you know, with COVID, we now have Paxlovid. With measles, once you get it, you can only treat the symptoms. So at this point, there's no reason to worry. The call to action is we need to get vaccinated and just take that additional step if our kids are not vaccinated or if we ourselves are not. So we're hosting a weekend of action this coming weekend, and all of us here are really pushing for that. Harris County, City of Houston, we're working with the community, with Legacy Public Health, Texas Children's Hospital, and doing that push for vaccines. We have also talked to our healthcare providers around the county to make sure that they're vigilant in recognizing measles symptoms and following proper protocols. There are mobile immunization trucks that Children's Hospital here will talk about in a little bit, so that we can get vaccines in areas with lower vaccination rates. If you were born in the U.S. after 1968, you probably have the measles vaccine. I mean, really, around the world, most countries, this is under control. But if you're not sure, just check with your provider. They can test to see whether you had the vaccine. You may want to get a booster. And then, of course, for children, any child over 12 months of age should be getting the vaccine. So they should get the first dose after 12 months and the second dose between ages 4 and 6. So there's a way for you guys to get appointments. If you have a primary care physician, please go to them for the vaccine. If you feel symptomatic, please go to your physician to check out those symptoms. Don't go to an ER, an urgent care that might be crowded again because of how contagious the virus is. And if you don't have health insurance, don't have a primary care physician, your child doesn't have health insurance, for whatever reason you don't feel comfortable going to the hospital, visit readyharris.org. Our Harris County Public Health Department, Houston Health Department, and other organizations like Legacy will offer vaccines free of charge for those. So readyharris.org, we have a map and we have information on the resources, and we're working on a call center. So let me pass it on here to the mayor. I'll repeat my remarks in Spanish after that, but I want to make sure folks know this is completely in our hands. We have no active cases right now. We've got the rodeo coming up. We already have to worry about floods and hurricanes and derechos, it turns out, so let's not worry about measles as well. Let's just enjoy our times and make sure we get those 12-month-olds vaccinated, and those, if there's any of you who are not vaccinated, that you get that done. Mayor.
Thank you, Judge, and thank you for your leadership and the collaboration, because we know a virus does not respect county lines, city limits. Definitely, we're all in this together. The remedy for everything we're talking about today, the judges has articulated our concerns. The remedy is being vaccinated. And if you have any doubt under your circumstances of have you been vaccinated, take the precaution of being vaccinated. The City of Houston is aware of the circumstances. We've reached out to all of our stakeholders. The Health Department last weekend provided an outreach program. We're discussing it daily, and we believe that if everyone will get vaccinated, anyone that can hear my voice, make certain you're vaccinated. Make sure your family members, and you will be protected from this virus. I want to, with the judge's consent, yield to my health director, who is monitoring this with our health department around the clock. We're very fortunate in the City of Houston, no detection of an infected resident. That's very important to emphasize. At this time, no one inside the City of Houston has been detected. The West Texas incidents, primarily from travel and lack of individuals being vaccinated. That's not the case here in Houston, and certainly the judge speaking for Harris County and our region. So let me yield to Steve Williams, the Director of Health, who he and his staff, all hands on deck. We're communicating. Go to your primary care provider. If you do not have one, talk to the city of Houston, and we will give you that outreach capability. Steve, would you please give us a status report?
Thank you, Mayor. My focus is primarily going to be on what we're doing from the Houston Health Department's perspective. We're primarily focused on prevention. We've been participating in weekly calls with our regional and state partners. You might also know that we're testing for measles through our wastewater surveillance center of excellence. We currently monitor 36 wastewater treatment facilities and 48 manholes for measles. We're going to start monitoring schools with low vaccination rates, several shelters, nursing homes, and 2 jails for measles. In January, measles was found in a wastewater sample that came from a wastewater treatment plant serving the area where 2 confirmed travel-related measles cases were found. And in response to that, we notified impacted groups. We put out a health advisory. We interviewed people that had a level of exposure, provided education, and quite frankly, thankfully, there were no cases that resulted from those initial cases. In response to this situation in West Texas, we've provided measles education to more than 500 medical providers in a town hall just last Friday. We also held a measles vaccination clinic over the past weekend. We're really updating our employees on measles so that we can have a common message when we're talking to people. We're also working with local providers, Texas Vaccine for Children providers, our adult safety net providers, asking whether or not they're actually open for walk-ins, whether or not they're willing to reduce their fees and accepting new patients. Part of this is to increase access to vaccination, because government, quite frankly, can't really do it all. We need to be in partnership with all of our medical providers. But maybe more importantly, we're really focusing our outreach efforts on schools and various independent school districts with low vaccination rates and daycare facilities. We actually know where the low vaccination rates are, and so we're targeting them. We've notified local hospitals and provided applicable communication and health education. All of our information and messaging will be available in multiple languages. If you're a provider and would like more information or to be included in our next town hall, we ask that you call 832-393-5188. Or for the general public, if you have questions, just give us a call at our call center at 832-393-5427, or visit our website at houstonhealth.org. This site will be updated regularly and will have useful information like finding a provider, guidance on vaccines, signs, and symptoms.
Thank you. And let me call up our local health authority, Dr. Brown.
Thank you, everyone. Good afternoon. So in partnership with Houston, we too want to make sure that the vaccine is accessible to all. You can reach out to us through our website, and also we'll be out on readyharris.org. But it is imperative that those who are able to get vaccinated do so, because the disease is completely preventable through vaccination. I do want to take a moment to go over some of the signs and symptoms, just in case someone may think that they've been exposed. So high fever is one of the cardinal symptoms. A rash that starts from the face or neck and works its way down, that feels more like a sandpaper rash and looks like a blotchy red rash. Conjunctivitis, which is tearing of the eyes and redness of the eyes, a runny nose, and perhaps some spots in the back of the throat may be symptoms as well. So again, we want to encourage everyone to get vaccinated, but we also want to advise the public on what to be mindful to watch out for if you think you have been exposed. And now I'm going to turn it over to Dr. Hotez.
Thank you. Well, thank you very much. I'm thrilled to be here. I wish it wasn't under these circumstances. Actually, the judge and the mayor got most of my talking points, so when next time CNN or MSNBC calls, I'm just going to refer them to you, and you can just do that. You did a great summary. A few things to think about. This is a very dangerous measles epidemic in West Texas. The numbers continue to climb. Every few days there's an update, and every time the numbers go up. The reason that's significant is because measles has what's called an incubation period of around 12 days, meaning from the time you're infected with the virus to the time you show symptoms is on average 12 days. It can go as long as 21 days. So every time you see the numbers going up from the state health department, it's evergreen. It means we're going to still be in this for at least another 2 weeks. And the fact that this is continuing to accelerate suggests to me that it's going to be around for quite some time. I don't see this going down anytime soon in West Texas. The good news is we do have an outstanding vaccine. I develop vaccines for a living, and when we talk about making the ideal vaccine for this disease or that, our paradigm is measles. We say our goal is, our aspirational goal is to make a vaccine that's as good as the MMR vaccine, because a single dose is 90% protective, and 2 doses is 97% protective. You're not going to get any better than that, and an incredibly safe vaccine, one of the best safety profiles of any vaccine we have. So it's important to get that word out. The other aspect of the vaccine is not only its protective effect against measles, but it's called MMR for a reason, because it also protects against mumps, and mumps is a leading cause of orchitis, testicular swelling in boys and males that could lead to sterility. That's yet another reason to get the MMR vaccine. And the R is rubella, which causes German measles, but the one you worry about the most is called congenital rubella syndrome. If a pregnant woman is unfortunate enough to get rubella, their child could be born with profound birth defects, including heart defects, deafness, intellectual disabilities. I've seen only a handful of congenital rubella cases and blindness. I've seen only from cataracts. I've seen only a handful of congenital rubella cases in my time, and you never forget them when you see them. So that is the message. I know we sound a bit like a broken record, but the best vaccine you can possibly imagine, an incredible safety profile, and that's the message, especially if you're going into crowded areas in the city where potentially there could have individuals shedding measles virus into the atmosphere. So thank you.
Okay, thank you, Dr. Hotez. We'll hear from Dr. Purse now.
Thank you, Judge. As Dr. Hotez pointed out, a lot of the biggest points have been already said. When you talk about measles, I think of it in, there's bad news, there's good news. You've heard a lot of the bad news. It is extremely contagious. It's very easy to spread from person to person, especially somebody who's unvaccinated. And when you become ill with it, we know, the judge pointed out, up to 20% of people who are ill are going to get sick enough that they require hospitalization. Well, the other 80% are going to still be really sick. High fever, body aches, feeling miserable, in bed. It is a miserable illness to get through. Most people do fine, but yeah, about 1 in 1,000 people are going to die, and there are some people who are going to have permanent neurological problems because it can affect the brain. So the bad news about measles is that it is very contagious, and it can make you really sick and have some horrible consequences. The good news about measles is, number one, and the judge mentioned this and others have mentioned, is that we've got pretty decent vaccine coverage, as evidenced by the fact that when we had the 2 cases here back in December, January, it didn't spread. It didn't spread for basically 3 reasons, and I want to reinforce these 3 reasons. One is that people who got sick, they got pretty sick. They sought help. They raised their hand. They went to their doctor. The doctor then made the diagnosis, which today is to be commended because so many physicians have not seen measles because it hasn't really been common for over 50 years. So the doctors were on the ball. They made the diagnosis. And then the third thing is that the people who were infected, they cooperated with the doctors and the health department, and they kept themselves at home so that it didn't spread. And so as we look forward and people worry about, might I get measles? Well, if you're worried about maybe getting measles, you need to get yourself vaccinated. If you know that you were never vaccinated, for example, you were born in some country, a foreign country where vaccination wasn't common, and you came here at the age of whatever, and now it's a couple years later, and you know that you weren't vaccinated, you can get vaccinated as an adult. There's plenty of vaccine available. We've already talked about ways that you can vaccinate it. If you're not sure, you don't know, you think maybe, but you don't have your vaccination records because that was a long time ago, that's fine. You can still get vaccinated. Even if you were vaccinated as a child, you get vaccinated again, it's not going to hurt you. So that would be the other thing. And then if for some reason you want to know if you were vaccinated, there is a blood test, but quite honestly, that takes several days. It's a little bit more expensive. It's probably easier to just go ahead and get vaccinated again. And then the other thing that I want to point out is that in our defense system, and Director Williams pointed out the wastewater surveillance. Our wastewater surveillance tells us right now there's no measles in Houston. As of this last week, there's no measles, none. And I'm really confident because when we had 2 cases out of 2.5 million people, we picked it up. That is an extremely sensitive way to detect if there's measles. So right now is not the time for anybody to get overly excited. It is not the time for anybody to get scared. It is the time to get smart, consider your situation, and if you need to get vaccinated, get vaccinated. If you have a family member that you're particularly worried about, they've got a chronic illness, they've got an immune system problem, they're vulnerable for whatever reason, remember, when you're ill with the virus, the person you're most likely to spread it to is a family member. So if you have a family member that you're worried about, your best line of defense is for everyone in the family to make sure you're vaccinated, because that's who's most likely to spread it to the person you're most worried about, okay? So that's all I have. Thank you.
I'd like to clear, because you were talking about December, and I was saying there are no active cases.
Right.
So that's what we're speaking to. Today, there's been no
there's not, right.
active cases detected in Houston, Texas.
That's right. That's right. And our wastewater is clean. There is, well, our wastewater is actually dirty, but our wastewater, wastewater is wastewater. But there's no measles virus, and there hasn't been since back December, January.
Who were travelers.
And they had traveled. That was a travel case, right? They had traveled internationally, caught it, and came back with it.
Okay, so let me repeat my remarks in Spanish, and in the meantime, I'm going to ask the other folks who are here if there's anything that we did not mention to please, come up after my Spanish remarks, and then we're going to take questions. One thing I want to make sure somebody talks about is about the babies, because you can only vaccinate children over 12 months old. So what happens if you have a baby that's younger than that? So I'll let one of the doctors talk about that. But let me just repeat briefly en Spanish. Primero quiero agradecerle al alcalde Whitmire, a todos los doctores y profesionales que están aquí, tanto de la ciudad, del condado y también hospitales y organizaciones en nuestra comunidad. Estamos trabajando todos juntos en este tema del sarampión. Muchos de estos doctores, los doctores en la comunidad, nunca habían tenido que manejar el sarampión. ¿Por qué? Porque en los años 60 empezó una campaña de vacunación y hoy día y desde hace ya varias décadas el sarampión prácticamente que no existe en este país, inclusive en muchos países alrededor del mundo. Si usted recuerda, de niños, muchos de nosotros nos pusimos la vacuna MMR, la vacuna contra el sarampión y la rubiola y también las paperas, sarampión, rubiola es la MMR. Esa vacuna es increíblemente efectiva, es una vacuna ideal, explican los expertos, pero ahora estamos viendo en el oeste de Texas un brote de sarampión. ¿Han habido casos de sarampión en los últimos años, las últimas décadas? Sí. Pero de repente hay docenas, de repente 100 casos, pero son casos no relacionados. Individuos que han viajado a un país donde no esté bajo control el sarampión, que no se han vacunado, y regresan a Estados Unidos y tienen sarampión, pero no contagian a nadie más, porque tantos de nosotros, la gran mayoría, 94% de nosotros, estamos vacunados. Pero ¿qué está sucediendo ahorita en el oeste de Texas, en el área alrededor también de Nuevo México? Hay 9 condados en Texas, un condado en el estado de Nuevo México, donde ya se ha esparcido el virus con tal rapidez y a tal nivel que es muy preocupante. Entonces, el 23 de enero se identificaron 2 casos de rubiola, sarampión en el condado de Gaines. En un mes, solo un mes, los casos se incrementaron a 168. Eso es el número de casos que tenemos en este momento. Y lo que hemos aprendido es que la gran mayoría de las personas con sarampión en este momento, en esa área donde hay ese contagio, son personas que no estaban vacunadas o que es incierto si estaban vacunadas. Aquí en el condado Harris no hay ningún caso activo, pero sí llegaron 2 casos hace un par de meses. Habían 2 personas que habían viajado y viajaron y llegaron aquí con sarampión. Pero nuevamente no se esparció el sarampión gracias al nivel de vacunación de la comunidad. Lo más seguro es que vuelva a llegar el sarampión. Con tanta gente que está infectada, tantos eventos que tenemos aquí, es casi que asegurado. Entonces tenemos que protegernos y asegurarnos que tanto nosotros como nuestros niños y como los bebés están vacunados. Es una enfermedad problemática, peligrosa. 1 de cada 4 o cada 5 personas que se infectan terminan hospitalizadas. Es muy contagiosa. Imagínense, el sarampión contagia, cada persona con sarampión contagia alrededor de 18 personas. Comparando con el COVID, cada persona con COVID contagia alrededor de 3 personas. ¿Por qué? Porque el sarampión permanece en la atmósfera, permanece vivo alrededor de 2 horas. Entonces, si estamos aquí, digamos que yo tuve el sarampión, estornudo, nos vamos y usted llega en 2 horas, lo puede contraer. Entonces, es por eso que la protección es la vacuna. Entonces, si usted no sabe si está vacunado, siga adelante y vacúnese. Si sabe que tuvo la primera dosis, no ha tenido la segunda, también contacte a su doctor de familia. Si empieza a sentir los síntomas, que es los síntomas normales de un resfrío, pero también con un brote, también de repente con unas marcas en la parte de atrás de la boca. Si empieza a sentir algo de eso, esa fiebre, esos ojos llorosos, vaya a su doctor individual, intente no ir a una sala de emergencias ni un sitio congestionado porque nuevamente es muy contagioso el virus. Y si usted no tiene doctor de familia, si usted no tiene seguro médico o su niño no tiene seguro médico, venga a que nosotros lo vacunemos, tanto el Departamento de Salud de la ciudad como el Departamento de Salud del Condado Harris y otras organizaciones sin ánimo de lucro. Ofrecemos vacunas sin costo alguno a tanto adultos como a niños. Puede encontrar la información en readyharris.org. Entonces, en conclusión, es la hora del rodeo. Es hora, ya casi viene el Spring Break, es hora de disfrutar. Tenemos aquí en Condado Harris huracanes, tenemos inundaciones, tornados, el tal derecho. No le sumemos ahora sarampión. Entonces, a vacunarnos los que faltamos y bueno, también inviten a sus familiares y amigos a que hagan lo mismo.